With COVID-19 vaccines being distributed around the world, a new strain of COVID-19 in the UK, a more infectious one, raises the question whether existing vaccines will still be effective. Now, for more on this, Professor October Sessions from the NUS Swee Hock School of Public Health joins us. Professor, how worried should we be about the spread of this new COVID-19 strain?
I think that we should definitely be concerned. It's something that we need to pay attention to. So, as we know, that what we've seen is this new strain is up to 70% more transmissible than the strain that's been circulating. And cases in London have nearly doubled, with the new strain accounting for 60% of these new cases. So,
perhaps you can,
we should be watching it.
Perhaps you can also share with us, with the current approved vaccines that's available on the market, will that work against this new strain of COVID-19?
Yeah, it's a good question, and people are looking at it right now. So what we can say right now is that the immune response that's elicited by these vaccines that are currently on the market are targeted against multiple parts of the virus. That's true in the natural infection as well as the vaccine. So these antibodies aren't just going to target the receptor binding domain of the ACE2 receptor that the virus uses for entry, but other parts of the virus as well. So one mutation or the mutations that we're seeing now in this new strain is not going to defeat, most likely, the immunogenicity that is afforded by these vaccines as they currently exist. But definitely something we should keep an eye on.
Well, Professor, reports say that this new strain, Professor, is in fact more infectious. There is also the possibility then that this virus could even mutate into a deadlier version, isn't there?
Yeah, definitely. It's possible. So right now there's no evidence that it is indeed more lethal. But I mean, we should keep in mind, right, that the old strain, the mortality rate is hovering around 2.2%. So any increase into what is already a highly transmissible virus is definitely something that we are currently working on, and many places are looking into. But definitely something we need to keep an eye on.
Well, thanks very much for sharing your thoughts with us, Professor October Sessions there from the NUS Swee Hock School of Public Health.